Nzioka Waita has outlined what Uhuru Kenyatta needs to see on the Big Four agenda. He emphasized on the need of young Kenyans owning homes at affordable mortgage. He also talked about security, universal health, and manufacturing.
On food security, the aspiration really is very simple. We want farmers to earn more money. We want food for each one of us to cost less. We want those Kenyans who are food insecure to reduce to nothing, and we want those children below 5 who are subjected to malnutrition to cut in half. Because right now we have over 4 million children below the age of 5 who are food insecure, and we really have to do something about the most vulnerable people in society. That is the food security aspiration. But underpinning that are huge policy reforms that will be undertaken within our agricultural space. Looking at smart subsidies, I see many of you may have seen the Ministry of Agriculture has published what they call the Agricultural Transformation Program. Under that, you will see a movement away from the current fertilizer subsidy to what we are calling smarter subsidies, more targeted, more tailored towards the farming communities. We are looking more to do aggregation of large holder farming. We are dealing with the issues of market access, specifically at 2 levels. One, you may be aware that the warehouse receipting bill is currently under mediation between the National Assembly and the Senate, but that in itself will unlock the trading of commodities. The COMEX, which has already been incorporated and is co-owned between the National Treasury and the Nairobi Securities Exchange, is one of those things we are looking at to really unlock market access, to improve price discovery for farmers so that they don't have to sit with their grain and their produce in their silos and their granaries waiting for farm gate prices to change. We really want them to know what these commodities are trading at, and it will allow us to start moving and start shifting our over-dependency on certain staples, because it will really enable people to sell. You know, we had a 2017-2018 harvesting period, we had a bumper harvest of dengu. I don't know how many of you know that story. And Kitui had several thousand metric tons of dengu sitting in the warehouses of the county. And the biggest challenge became a market access challenge. Not because there's no demand for dengu, but because the government had not linked, both at national and county level, how to offload those to those markets in a transparent manner, and to really encourage those farmers to keep planting dengu. Because people in Kitui ought to spend more money on dengu than planting maize, which 9 out of 10 times fails. And these are the sort of reforms that are underpinning this agricultural space. Looking specifically at arenas like value addition in the dairy sector, in the potato ware sector, by improving the cold chain facilities and democratizing access to the cold chain facilities. You have parts of this country, Nyandarua, Kaptagat, and others, who produce bumper crop of potatoes, but they are forced into captive selling at farm gate because they do not have ability to store and deal with post-harvest losses, and to be able to have a bit more control on the pricing. So if you amalgamate all these initiatives that are taking place from an activity point of view, you can see, because it's not the government that is going to build all the cold chain facilities, it's not the government that is setting up agro processing plants. You know, if you take an example of what I came to now know through watching KTN, parachichi. You know, who knew avocados were called parachichi? I mean, I didn't know, but now I'll never forget it. And the real issues about market access to export opportunities for our farmers. And the big challenge we have is not that we just don't have enough avocados, and we grow them in smallholder farms. And one of the big challenges that are affecting our ability to export fresh avocado as opposed to frozen avocado is the consistency in pest control and management. So we need to organize the same way we organized our coffee and tea sectors, is to organize avocado farmers, macadamia farmers around those supply chains, and allowing them to amalgamate and coordinate their planting seasons and harvesting seasons, because today we've had investors rolling in and out of town from China and other places within the East coming to look at the market, and they're saying, look, I won't commit to purchasing until I have a minimum acreage of 10,000 hectares of avocado, because the demand continues to rise across the world. And Kenya is blessed with one thing. We have great soil. Wherever you go, we may have challenges with weather and things like that, but we do have great soil. When it gets water, we have bumper harvests, and we are able to produce quality products. So these are the kind of opportunities we are creating, underpinning these aspirations on food security. And as you can see, they're all private sector-led initiatives. We know the government's history with farming, so we would rather you do it, and we facilitate it for you. Under the Universal Health program, coverage program, what do we expect in terms of simple outcomes? Number one, every Kenyan should be within at least 30 minutes of a primary health care facility that offers them affordable, good quality health services. Number two, as a percentage of disposable income, we would want Kenyans to spend less on medical care, because today most homes, as you heard from His Excellency the President on Madaraka Day, are one medical bill away from impoverishment. It just takes that one relative who is having stage 4 cancer, whose chemotherapy treatment running into 150,000 shillings a week. You can't wish away your family or your friends or your relatives. You must do something to help them, and that is putting significant strain on majority of our households across all social strata. Whether you're rich, whether you're poor, whether you're humble, whether you're arrogant, you fall sick. And this is something that we need to confront. The last outcome we expect under universal health coverage is really to increase the life expectancy. Today, Kenya is ranked somewhere around 147 in the world in terms of life expectancy. We are looking at about 67 years of age as the average life expectancy on male and female. It's an improvement from 1963, but we're not in 1963. We are in 2019, where the average life expectancy that we should be aiming for is over 72 years. And that's what we must aspire to as a people. Underpinning those aspirations are, can we get the cost of pharmaceuticals down? Are there opportunities for local production for these pharmaceuticals? Can we take affirmative action steps to have more of our drugs manufactured here? Can we deal with IP issues and proprietary issues that have made drugs extremely expensive for our ordinary men and women? Looking at our primary healthcare infrastructure, doing more to improve the quality of dispensaries and health facilities at the local level. These are devolved functions, but they are functions which must be done jointly between the national and county governments to strengthen just the quality, because if we don't get the referral system back to what it should be, then we'll have a challenge. Ideally, we should not have people queuing to get into Kenyatta Hospital, because Kenyatta Hospital is an apex facility. It sits at the top of the medical food chain, yet people are going there with very basic ailments and illnesses and congesting those corridors. Those people should be at dispensaries, level 1, level 2, level 3, and referred up to, depending on the complexity of what their ailment is. And that is what we are trying to get back on its feet. It's not a walk in the park, but it's something that must be done. And I'm sure when you read the papers, you can see the challenges that afflict the healthcare system. Trying to get some harmony within the labor force, professionals, doctors, nurses. That doesn't happen overnight, but it must be an aspiration that we all target ourselves towards. It does provide huge opportunities for technology, because we'll never have enough doctors. The doctor-patient ratio will never be what it ought to be. You can't produce doctors overnight. These are people who spend significant portion of their lives behind books. So you don't churn them out. They are really people who go through a process. So we need to increase the multiplier effect of each doctor. And that's where technology comes to, using online referral systems, making sure that all our level 4, level 5 and referral hospitals are linked through technology, so that oncologists can serve people from one central point and just pick data coming through our managed equipment service system and be able to serve people from central points. Those are not government, they are government policy initiatives, but they are private sector-led interventions. On the manufacturing side, today manufacturing accounts for roughly about 8.2% of GDP. We would like to see it going to 15%. And the opportunities are massive. It's one of those softer things which really government has to really put in the correct policies and environment for. It's not something where we can do so much hardcore infrastructure. I mean, aside from roads and electricity, what the manufacturing sector needs is the correct policies in place to enable them do what they do best. And just to give you comfort about what we are looking at, and I don't want to preempt budget statements, but we have been engaging with the private sector at all levels, at SME, import trader level, and I'm sure you know the stories that have come from downtown, our traders who have relied very heavily on imports to sell. And today, if I was to just summarize it, the import substitution opportunity that lies for our local manufacturing is about 1 trillion shillings worth. So at the end of this financial year, we will probably have spent upwards of 1 trillion shillings as a country on imports. If you exclude petroleum from that, because we are not at a point where we can consume our own petroleum, generate and consume our own petroleum, what are we importing? We're importing second-hand vehicles. We're importing close to 100 billion shillings worth of second-hand clothes, textiles and fabrics. We are importing finished products like tomato paste, jam, cornflakes, stuff like that. We are importing agricultural inputs, fertilizers, pesticides, fungicides, and all those kind of things. We are spending an inordinate amount of our cash importing wood products and cupboards and shelves and things. Now, out of all those items, at least 80% can be manufactured locally. And it is our intention as government to create the environment for that substitution to start taking place. We import on average about 50 billion shillings worth of steel billets, yet we have the capacity locally to produce those steel billets. And what has been missing is the policy coordination between the taxation environment and the aspirations and outcomes that we have been looking for from the manufacturing sector. I just want to give you the comfort that this is something where you will see tangible steps being taken to deal with that misalignment. And this is led from the President himself. Some of you are members of the Kenya Private Sector Alliance, and you know the amount of time the President has spent in the boardroom with you over the last month. And what we expect now is to see outcomes from those meetings that now reflect these aspirations. Maybe I would want to leave in our discussion, Abby, some of the questions that you may want to ask about the opportunities that come out of the Big Four. But I would want to say this at the very outset, that it is very important for this community here to support the government's efforts to deal with corruption, to deal with counterfeiting and illegal imports. Because however we circumvent this discussion, we must come back to the question of whether we want to remain consumers as a nation or we want to graduate to being producers. Because today we have listed companies whose shares are underperforming because they are under siege from illicit imports. When you look at companies like Everready, when you look at companies like East African Cables, who have suffered huge losses on account of imported counterfeit materials, and we have now started to stop those imports. It has raised a lot of ruckus from certain constituents, but this is something we must confront, because we cannot allow a few people to profit at the expense of a wider base. And these are difficult and unpopular decisions, but I would want to assure you that the President is committed to doing the right thing, however unpopular it may be, because in the fullness of time we are seeing it reflecting in the performance of these companies who employ our young men and women, and some of them support investors who are in this room. So some of us who may not drink alcohol want to see East African breweries continuing to perform well, but EABL have been on the receiving end of significant counterfeiting activity in the spirits segment. Companies like BAT, who have again having to deal with the smuggling of cigarettes and tobacco products that have been coming into the country illicitly. We have taken very deliberate steps to cut those flows, and I'm sure it reflects well in the performance of those companies, and we hope that they will be able to pass on some of those benefits ultimately to the consumers, and that value to their shareholders. If we look at the housing sector as a case in point, we're looking really just to extend dignity. You know, an aspiration to have 500,000 new homeowners by 2022 might appear to be a stretch, but it is extremely possible working with the private sector, because through this initiative, number one, you have already seen steps to get mortgage rates to single digit with the incorporation of the Kenya Mortgage Refinance Company. Some of you are shareholders in the Kenya Mortgage Refinance Company, and that is purposed really to on-lend funds to SACCOs and other lending institutions for Kenyans to be able to own and afford their homes at, first of all, interest rates at a single digit, and secondly, on tenures that move away from being short-term loans into being real mortgages, from 10-year facilities to really 20 to 25-year facilities that give people the time to repay these loans and to get the fear out of our young people from owning homes, because now they are really scared of this debt. But a debt that can be spread over 25 years, that allows you to pay a mortgage that is equitable to your rental income, really gives huge opportunities, and we expect to see mortgages increasing from the current 26,000 to about 60,000 in the near term. Of course, we will be more bullish, but we would need to really make this case to the people in this room to get those numbers up. The housing aspiration also has a number of other issues, really cutting down the cost of land, cutting down the cost of building materials by embracing new building technologies, licensing new building methods, and really try and cutting the red tape involved in construction of one owns home. A lot of the housing projects that we have already initiated and that are publicly known today are all PPP led. The government, through the National Housing Corporation, is doing a few of its own projects sticking to the National Housing Corporation plan. But 90% of what we are doing will be led entirely by the private sector. What government is focusing itself on is building the demand side to make sure that at the point of completion, those homes are able to be offloaded at an affordable cost, and really embracing what we call rent-to-own mechanism, which is basically today whatever you're paying in rent is what you should be able to pay to own that premises. On another occasion, I would want to unbundle that more, but maybe later we talk about the opportunities that it affords for the private sector and for companies that are looking to scale up and possibly come knocking on the doors of the Securities Exchange to raise the necessary capital.